Okay. Hello. Am I audible?
Sir.
Yes, sir.
Yes, sir, audible.
Yeah.
Now we are seeing. Yes,
Yes.
sir.
Yes.
You are audible and you are clear, sir. You are clearly
Yes.
seen.
Yes. So in counseling techniques, first one is communication techniques, communication skills first, then therapeutic techniques. Okay. In communication techniques, there are two important aspects. One is verbal communication. Second is the non-verbal communication. Verbal communication and non-verbal communication. In verbal communication, the language and this your voice modulation, sound, tone of voice, this all comes under this verbal communication. Verbally, you need to counsel. Okay. So in counseling process, verbal communication plays a vital role because of your communication skills and your listening skills. It plays a significant role in communication process. So your language, how you utilize or use your language, your voice modulation. So in some cases of, for example, it is a telephonic or online counseling. So your voice modulation also very important to know the various issues related to the client or the patient. So you need to speak in a clear-cut manner. Clarity, your voice modulation also important in case of online counseling as well as telephonic counseling. Your sound, the language you are using, whether it is simple language you're utilizing, whether you have any complexity is there in your language, based on the other side of the client, like for example, the child-related cases, maybe elder-related cases. For example, some cases may be couple counseling. In that couple counseling also, some confidential aspects they will discuss maybe in one-to-one counseling or it may be in telephonic or online counseling. In those cases, so you need to modulate your voice. As I mentioned, the listening skills also, there are some skills we already mentioned in the previous class. One is that solar. What is solar? Micro listening skills or micro communication skills. Solar means S is for sitting position, O is openness, L is lean position, E is eye contact, R is relaxed position. So these type of these micro skills we need to use when we are doing the counseling. Okay. So communication, these are all various aspects in the communication skills, that is verbal communication. In non-verbal communication, again, your attending skills, your active listening skills, your body language, okay, your eye contact, tone, facial expressions. For example, in the first session, some cases, some issues, they came with you with some these issues due to their emotional disturbances, because of their emotional issues. They may not be in a position to express in a verbal manner because of their emotional disturbance state, emotional imbalance state. They are not stable in their emotional issues. That is the reason in first session or in first interaction, better to use, if they are not in a position to express in the verbal manner, better to discuss, better to counseling in non-verbal mode or non-verbal communication way, like touching, if it is any need, your facial expressions, head nodding, active listening, and that is this type of some type of cues. Okay, so this is all comes under the non-verbal communication system. Communication in two ways. One is verbal communication. Second is the non-verbal communication mode. Okay. Same way, there are different type of therapeutic techniques like counseling techniques, including communication techniques. Second is the therapeutic techniques. In therapeutic techniques also, there are different type of therapeutic techniques, therapies. One is systematic desensitization technique. Systematic desensitization. Sensitization, desensitization, and systematic desensitization. Okay. In systematic desensitization, for example, if it is a phobia case. In phobia case, you know that there are different type of phobias like hydrophobia, hytophobia, okay, agoraphobia. In these type of phobic cases, especially for children of phobic related cases, this technique we can use. One is systematic desensitization. As I mentioned, sensitization, desensitization, then systematic desensitization, stepwise desensitization, sensitization. So anxiety issues are there. So the child or the person, the individual is anxious. He is fear in reaching the third floor of the building. So when he entered the third floor and when he entered the second floor, his anxiety will reaches its peak stage. It's maximum. That is the reason some sort of shivering, some sort of dry mouth. These symptoms you can observe in this case of phobia. So in this particular case of phobic, like hydrophobia, agoraphobia, or hytophobia, any phobia, then nearly we have 8 to 10 types of phobic issues. In this phobia, so what to do? First of all, as I mentioned, three words or three sentences, three dividing parts in this particular technique: sensitization, desensitization, and systematic. Sensitization means it is sensitizing of anxiety. That sensitization, that anxiety, we need to desensitize it. Okay, reduce it, desensitize it. That is reducing the anxiety. How? Systematic, stepwise, systematically desensitization. So in this technique, for example of hytophobia, ask the client to come to the first floor, to enter into the first floor. When he entered into the first floor, what happens? These are the symptoms, as I mentioned: dry mouth, shivering, okay, and some sort of sweating. So these symptoms of that is phobic issue. So it shows this type of these symptoms you can observe in the client, like shivering, dry mouth, sweating, right? Okay. So here, systematically desensitization means ask the client to stay for some time in the same first floor, in the same situation, same condition. Whenever the moment he entered into the first floor, these type of symptoms we will observe in the case. Okay, though the symptoms are there, but still we need to ask them to wait for some time in the same situation, same first floor. Slowly, what happens? These type of symptoms may be, for example, if it is the 10 points of anxiety is there when he entered, the moment he entered the place. Slowly, if we ask him to stay for some time there, slowly, that peak stage may be reduced gradually. In this particular context, in this particular situation, ask him to to practice some sort of techniques, relaxation techniques, deep breathing. Though those symptoms are observed in this client, we need to ask them to practice some type of relaxation technique, like deep breathing, breathe in, breathe out, okay, or visualizing some sort of new things. So what's happening here? When the anxiety is reducing, he is practicing some sort of relaxation techniques. He is doing some sort of, he or she is doing some sort of relaxation technique. So relaxation techniques are, relaxation is improving, relaxing is improving. Slowly, slowly, that type of this anxiety is reducing. So when the relaxation techniques are improved, the anxiety, the quantum of anxiety, slowly it will be reduced. So that is the technique we have to use in the first session or first day when she reaches the first floor. So the same technique we have to do for 3 or 4 sessions, 3 or 4 times, the same day, morning and evening, or else second day morning, the same 3 days or 4 days. So that means now he is comfort to reach in the first floor. No anxiety after some 3 days or 3 sessions. Now ask him to reach the second floor. Why you call it as a systematic desensitizing step by systematically we are desensitizing that anxiety, reducing that anxiety. So the same procedure we need to follow, we need to continue for the second floor also. Okay. Then ask him to stay for some time in the second floor, for some sessions in the second floor. So after 3 or 4 days, the same person ask him to reach that, to come to the third floor. So this is the way to reduce his anxiety by doing systematic desensitizing techniques. Same case, if there any other type of phobic like hydrophobia, some patients or some cases, they if they see that water like canals, ocean, or any other rivers, their anxiety will be reaches its peak stage. So in that case also systematically we can reduce that anxiety. That is systematic desensitizing desensitization technique. Then another one is implosive therapy. Okay, here flooding. Systematic desensitization technique, the difference between the systematic and the implosive therapy is that in systematic desensitization technique, what happens, hierarchy from lower stage to higher level, to higher level we will practice. But whereas in the implosive flooding, the higher level of hierarchy will start now. Slowly, we reduce the intensity of that issue. Okay, hierarchy will be from lower level to higher level. In case of systematic desensitization, like as I mentioned, systematic desensitization, what we will do first of all, ask them to wait for some time in the first floor, then second floor, then third floor. Whereas in the impulse therapy, what happens directly, we will take him into the peak stage, third floor. That is flooding. Whatever the thoughts, he, whatever the feelings, whatever the emotions he experienced in the third floor, ask him to wait for some time in the same situation, flooding. Let him go. Let that feelings will go. That is known as the flooding. So in hierarchy of implosive therapy, so ask them to wait in the same situation, the higher level. Slowly, from the third floor to second floor to first floor. That is the second this thing. Then another important therapy in this case is aversion therapy. In this type of the counseling is first one, as I mentioned, systematic desensitization. Second is the implosive therapy. Third is the aversion therapy, especially in the case of drug addictions, alcoholic cases. In these cases, this type of aversion therapy. Okay. In this case of aversion therapy, especially especially for maladaptive behaviors, smoking, drug addiction, drinking habits. For these cases, we use aversion therapy. Aversion therapy means some sort of techniques related to the some sort of current. Okay, so some sort of techniques we use in the help of the that is psychiatry professionals. Okay, so you know that some sort of current or some sort of shock they will give whenever they have that type of maladaptive behavior. What happens immediately whenever they wanted to do that this habit of drinking, smoking, or alcohol? Okay, this type of current, this type of this electric shock, if we give to the these patients or the clients, so immediately whenever they want to go for that type of admission, that is addiction, they will realize and they will experience whatever the shock, whatever the it is experience, bitter experience they experienced while doing this type of current shock. Slowly, 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 what happens? They will stop taking that substances. Whenever substances they wanted to take, they wanted to start the taking of substance, like smoking, alcohol, or any drugs. So this type of experience, whatever their experience in the previous, like with the current shock, they will have that type of feeling whenever they wanted to take that particular substance. So slowly, 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 what happened? They will stop taking the substance of this thing. That is known as aversion therapy. Systematic disintegration, explosion, and aversion therapy. And some sort of training is assertive training. Assertive training also one type of technique in the counseling procedure. Assertive training. So, for example, if there is any odd behavior, abnormal behavior, train them to behave in a assertive manner, positive way of talking, positive way of doing the things, simple way of doing the things. In assertive training technique, so assertive manner, positive way of doing the things, positive way of thinking, positive way of talking. Whatever they wanted to express, that should be in a positive way. So when they think in a positive way, definitely the talk, the conversation, the expression also will be a positive way. So this type of training we have to provide in assertive training techniques. Assertive manner, positive manner of positive way of thinking, the positive thing. Always ask them to wait for some time and ask them to wait, ask them to think in a positive way. Some cases, what happens due to their behavior, due to their abnormalities, they forget thinking in a positive manner in some cases. For example, if you ask them, though he has some capabilities, though the client have some sort of positives, some competencies, they won't bother about those competencies. Always they think about their negative aspects. That is habituated. Those clients are habituated to that particular habit. So in that case, ask them to identify those positives. So if you ask the positive aspects of that client, that person, he won't even remember. He won't even recall. He don't know about his positive aspect, positive things. That means always his way of thinking is in a negative manner. That is the reason he or she may not be in a position to think in a positive way. So we need to ask the client, just you identify some qualities of positive from their own life. That is nothing but introspection. We have some methods of psychology in the first year of your PG psychology, initial units. There are some methods of psychology. First method of psychology is introspection method. Introspection method means seeing in his or in her own self When we see your own self, when we see our own self, we will be in a position to identify your positive qualities, plus points. And we also are in a position to identify our negatives also. So that is introspection. Here in this case of client counseling, we need to just ask the client to identify his positives as well as his negatives. When it is possible, when he or she introspects, when he or she see in his own self, then only it is possible to identify his positives as well as his negatives. In assertive training method, so just you need to ask the person, the client, to introspect, to identify his positives and negatives. When he identifies his positives, it is possible to improve his positive qualities or competencies or capacities. The same way, when he or she identifies his negatives, it is possible to reduce their negatives. So that is the way you train, we need to train them in thinking in a positive way. That is in assertive training, assertive manner of thinking, assertive manner of doing the things, assertive manner of talking. The same expression, the same way of talking, you need to modify in an assertive manner. So another important technique in counseling is relation technique, relation maintenance of the good relations. So in any this counseling procedures, relation training with the relation means we have to maintain the good relations with the client. That means, as we know, we have some therapeutical techniques like uh, humanistic approach. In humanistic approach, Carl Rogers' humanistic approach. So we have to give topmost priority to the client because he is also an individual. Maybe the problem is only with some limited time, but always we need to respect to the client. We need to give the respect to the client. You better to focus on the person's problem, but always you need to think in a empathetical manner. Empathy is a major, you know that humanistic approach also known as the tried approach. Tried approach, TREID, tried approach. Tried means three. What are the three important aspects of the humanistic means? One is empathy. Second is unconditional positive regard. Third is genuinity. Okay, genuinity. The problem is whether it is genuine or not. That we have to see. If the problem is genuine problem, so we need to show the empathy, empathetical understanding from the client's perspective. Got it? Understanding from the client's perspective is also important. So here in this case of relation training, so here conditions for effective helping according to the this type of relation training. So you have to effectively maintaining the interpersonal relation to the client, interpersonal relations. Okay, whatever the emotional status of the client, emotional situation of the client, if you maintain the relations or you can maintain the relations, you give that relation training, not only you provide that proper relation to the client, not only that, we need to train up the client to maintain the relations properly to the others also. That is known as relation training. Both are interlinked, asset training as well as the relation training. In some cases, the problem is with the relations only. They don't have proper relation with others in the group, others in the family, the other members in the workplace. That is the root cause of the issue. As I mentioned, in psychological counseling, don't be hurry in solving the problem of the client. Try to find out the reason of the issue. If you find the reason of the issue, that is easy to give the proper solution. So in case of relation training also, just we need to find out the root cause or reason of his behavior, his issue or her issue. If you find any problem of relation maintaining, so better to provide relation training to the client. This is also one type of technique in the counseling procedures. As I mentioned, two important sub-technique. One is communication. In communication also there are verbal and non-verbal communication systems. Second is therapeutic techniques. In therapeutic techniques also there are 4 or 5 techniques like systematic decision exploration, then assertive training, relation training, and aversion therapy. Okay, these things we need to remember when you are doing the counseling to the psychological counseling to the client. So in other these areas of this counseling is counseling for marital, family, and elderly people. Counseling for marital, that is marital counseling, you can say marital counseling. So in marital counseling also there are so many techniques we have to use in marital counseling. In marital, some type of marital counseling is premarital counseling, post-marital counseling. Premarital counseling means before going for marriage. So there are some cases of need counseling while they are planning for marital stage, marriage. Okay, here in this case, personal counseling is family counseling. In this family also some sort of benefits of getting married. Those things we have to explain in this premarital counseling. Okay, so here so explain while you're doing the premarital counseling. Marital benefits like physical benefits, mental health issues, mental benefits, some sort of satisfaction related to the physical, some sort of satisfaction with the mental aspects. These things we have to explain when we are providing the premarital counseling. Then in premarital, another important thing is better marital harmony. After marriage, post-marital counseling, better marital harmony. Smooth relations even after completion of their marital registration. Okay. Counseling is related to premarital, postmarital. So personal aspects we need to discuss some sort of benefits of family, physical, and some sort of benefits in the mental therapies. In some cases, maybe some crisis if arised in marital life, those things also may be in our counseling practice that you can find sort of cases of crisis. Okay, one this from this crisis maybe lack of empathy towards other the like wife to other spouse. Okay, some issues related to the lack of love. Okay, in love also there are different type of companion love and passionate love. These both are essential in the marital life. So if you find any lacking of this type of love, companionship or passionate love, we need to address those issues also while giving marital counseling. And in marital counseling, some uh, issues may be related to the sexual aspects, like confusion of sexual orientation. That is confused state of sexual orientation. That also one area we need to address in the couple counseling or marriage counseling. In some cases, sexual violence or abuse. These cases also you find these cases in counseling process. We need to address these issues also to address sexual violence or sexual abuse in some cases. Here we have to find out the root of these choices or sexual abuse. The reasons may be his or physical aspects. The reasons be his or her mental health issues. The reasons could be his or her emotional issues or maybe some relationship issues. As I mentioned, this type of cases, if you find, you need to focus. First of all, we need to focus on their reasons, factorial reasons. In some cases, confusion about gender identity disorder, JD. Gender identity disorder also. Confusion about their gender. If any failure of their physical, psychological, emotional issues in this area, they feel about they will have some sort of doubt about their gender. That is gender identification, gender identity. Confusion about gender. If we sort out the issue initial stage, these type of stages, these type of cases may not be defined. Whenever, if you are not in a position to identify those issues in the initial stage, slowly, what happens? They will be in a severe situation of gender identity disorder. This also we have to address while we are giving sexual counseling. Another thing is specific sexual problems. Specific special problems also some sort of cases we will find. Generally, in this type of cases, generally we find this type of case in telephonic or online counseling. One-to-one counseling, generally they won't come because of their various reasons. In telephonic counseling, elaborately, clearly, they will express their issues in the telephone because directly it's not so easy. In some cases, it's not so easy to express their issues in one-to-one counseling. That is the reason uh, they will prefer to get the counseling through online mode or telephonic counseling. So this type of confusion about gender, like gender identity disorder, specific sex problems like unsatisfactory sexual life, in case of erectile dysfunction and premature ejaculation. These are some issues they will reach the counselor or the psychologist through telephonic mode or online counseling. Whatever the mode may be, whatever the system may be, whatever the procedure may be, we have to identify various reasons of these specific sexual problems. Another important thing in uh, this marital counseling or couple counseling means change after childbirth. Change after the change may be either side, any whether wife or husband, especially in the these female cases, their attitude towards sex, their attitude towards husband, or their attitude towards wife may be changed after birth. But you need to understand, they need to understand it is only for time being, for short time only. That is the thing we have to explain as a psychological counselor. Due to their female, due to their various changes in their bodily changes, health issues, those are the results of the change attitude towards others. These things we have to explain to the person coming to your that is counseling. We have to explain that it's only a temporary change in the attitude. After some years, for example, if the female cases, they need to spend time, most of their time, to the small children, no? Like babies, infant age, that is babies. That is the prime responsibility of the mother to spend their time to their newborn child. So some these cases, that is especially husband case friends, they won't understand the things of their that is needs of the children. As a counselor, as a psychologist, we have to explain these various aspects to the these persons, so that they will understand various problems of the that is mothers. In some cases, changes in the body, not only changes in attitude, changes in the body, importance of giving to the needs of the husband may be changed. It's only for some time being that those things we had explained the is family members. So this is all related to marital, sexual, and what is postmarital counseling. Another important area of this counseling is family counseling. You know that family is an agency in development. We have some agencies of education, agencies of society. Family is one of important. Family plays an important role in society. So there are three basic step system of organized society. One is individuals. Some group of individuals form a family, from family to society. From individual to the family, family to society. Okay. So interaction in the family, mutual understanding in the family, family system. Whether the family system is the joint family system, extended family system, nuclear family system. Based on that, the interaction in the family. How the social network of the family to the society. How the relations of the family with the other members in the society. These are all the things we had to observe while while providing the family counseling. So first of all, we have to I understand the family system first. Whether it is a nuclear family system, joint family system, or extended family system. Okay, how the relations in the family, how the sibling relations, any sibling rivalry is there in the family, especially in the giant families, the responsibility of the grandparents, parents, slowly, it will reduce. The main family members are only the source of the, especially income source of the family. So these financial aspects also we have to check, we have to verify when we are giving the family counseling. Then counseling to the women counseling. So in women counseling, again, there are different type of women. One is how the role of the woman in the family, because she has to play a different roles in the family as a wife, as a mother, as a significant that is family member having some source of income. So the role of the family member, role of the woman in the family, some cases dual role, means as a family member, as a working woman. So in that case, how their emotional situation, whether the other family members are giving proper importance to that particular woman or not. Some type of conflicts about the role of the woman. For example, as I mentioned, mother role as well as the wife role. Some sort of conflict of these both roles. Which role has to be preferred as a mother, as a husband, as his wife? Those also we have to check, and accordingly we need to give counseling to the patients. Then career guidance, especially in case of women, some sort of guidance related to career career. Some person, some women, they may have good education, higher education qualifications, but after marriage, they won't be in a position to utilize their knowledge on their days of qualifications. Due to their not utilizing of their skills and knowledge, they have some sort of dissatisfaction in the family. You can say it is an identity crisis. Nobody is identifying his sorry her his skills or competencies. It leads some sort of dissatisfaction in the family. No encouragement from the family member side. That could be the reason of her psychological or other issues in the family context. We better to address those type of issues if it is any issue related to their career. So this type of career guidance we are supposed to provide when we are giving counseling to the women. Lack of encouragement, lack of motivation in the family, though their confidence, self-confidence slowly maybe decrease. So in the cases also, we need to give counseling to the other family members as well as the same person who are having this type of issues. How to improve the confidence, how to have motivation, motivation will be external motivation or internal motivation. Career guidance also have some sort of plans, for example, based on their education, based on their qualifications, based on their experience of the women, to provide family, career guidance to the women. That is also comes under one type of women counseling in these processes. Some women in cases, due to their conflict, due to their domestic work, due to their dual role as a family member, as a working woman, they just about health, they about their food intake, which leads some sort of psychological or health issues, physical or mental issues among women. So better to identify those issues with mental future time in that area also as a psychological counselor we have to focus. This is all about women counseling, like role that is double role of men in the family. Any conflict in their role, if they have any conflict over the role of the that is both, that is also we have to check. Then if it is needed, career guidance also we have. Some family, some women, there is some gap after marriage, during their marriage, after getting some children. Maybe some have 4 days, not addition of 3, 4 years of time. So better to focus on the career. Maybe that 3 or 4 days gap may be there. Even after some years, they can focus on the career. They can plan for the future of their career. In the area also, guidance is needed from the counseling procedures, so that they'll have some sort of self-reliant, self-confidence. So they also play a important and significant role in the family. Then another important area in the family counseling is elderly counseling. Elderly counseling. In elderly counseling, after 60 or 62 years of age, they'll retired. The elderly people, they are working, they retired, maybe women or men. So orientation to retirement is important. What to do after the retirement, how their leisure time to be placed. Okay, so it's not so easy because after 60 years, it's not so easy to adjust with the family. Some adjustment family issues may be adjustment issues may be raised in the family after retirement. Why? Because their financial status maybe it is reduced, economical problems may be arranged, the role in the family may be it is changed after retirement. So due to these reasons, some sort of adjustmental issues, maybe family adjustmental issues or financial adjustment issues may be arised. Some these cases, some individuals they feel worthlessness after retirement. In some cases, family members may not give that much of importance to their elderly people. This also leads to a lot of worthlessness, feeling of despair, dissatisfaction, low self-confidence, low self-esteem. Though they are played a vital role in the family till their age of 60 or 62 years. But after retirement, they find some sort of discouragement, demotivation in the family, it leads some type of health issues, emotional issues, or issues related to the mental health. Physical health, mental health, and emotional health issues may be arised due to their role in the family, not giving proper importance in the family. In that cases, better to suggest the people of elderly people to utilize their time in a systematic way. For example, leisure time activities. They need to participate in the leisure activities, or they need to participate in the activities related to that association. Maybe any these charity activities, any activities related to their nearby family members, relations, or if they are healthy, if they are mentally, physically healthy, try to utilize their skills, competencies in meaningful activities, which those are they may be they may be in a position to help us in a social service activities, in the societal benefit activities, or they may give some sort of advice to the family members in the family or nearby family members. Due to their financial these issues, they may feel some sort of dissatisfaction, despair, demotivation within the family members, within the families. So if we find this type of these issues in the family, we have to uh, this counseling to the family members or the family, elderly family members, and some sort of this health issues like elderly problems, you can say Parkinson disease, stroke, heart disease, cancer, diabetes, thyroid disorders, vitamin deficiency, Alzheimer's dementia. Okay, like if you find these type of health issues in the at least elderly people, better to suggest them to consult it is a specialist based on their health issues. Some issues related to the physical health, some are related to the mental health. For example, stroke and diabetes, these are related to the physical aspects. Better to approach, better to consult specialists related to the issues. Some health issues related to the mental health, like Alzheimer's dementia. Alzheimer's dementia may be the forgetfulness. We need to find out that forgetfulness, Alzheimer's dementia, due to their brain dysfunctioning or some sort of issues related to the mental health, not giving proper importance to the family. In the family, slowly, what happened? They will detach from the family members.
వేరే కాల్ ఉందో బిజీ ఇంత నీరసంగా ఉంది
Got it? Am I clear? Hello, all of you, am I clear? Are you able to understand what I'm
Yes, sir. Yes, sir.
teaching? Yeah. So this type of elderly people, they have some sort of health issue. That health issues may be, as I mentioned, both sides. One is physical health issues, maybe some sort of mental health. As I mentioned, in case of stroke, or diabetes, or any other cancer like heart disease, like better to approach the first consult. These are all related to physical health issues. Some health issues are related to the psychological, mental health, related to mental health issues. In that cases, so better to consult the psychological counselors. That is our role to address these issues. For example, as I mentioned, Alzheimer's dementia. There are two important aspects of Alzheimer's dementia. Brain dysfunctioning is one reason, one root cause of this Alzheimer's dementia. Second is forgetfulness related to the brain dysfunctioning. Second may be if the family members are not giving proper importance to the elderly people of retirement after reaching certain age, what happens? They feel some sort of this gap in the family. They feel some sort of demotivation, discouragement from the family. Which leads, for example, if you are not giving proper importance till 60 or 61 when he or she is in the service, every test you are getting, everything you are asking that particular elder people. But after retirement, slowly, you are not in a position, you are not giving proper importance to the elderly people. What happens? From the elderly people side, they will feel some sort of this discouragement. So slowly they'll detach in the family. instead of emotionally attaching in the family members, they themselves detach from the family, which leads, because they are not giving any importance to their people, they feel, I am not given proper importance. So better to detach, emotionally detach from the family. So they will isolate. These isolation leads some sort of detachment, emotional attachment in the family. Some cases, as I observed, some cases of nostalgic dementia due to the these relations in the family only, not given proper importance of the particular elderly people. They detach from the family, emotionally detach from the family. Then they start feeling isolate, emotional disturbance state, birthlessness, despair. As we know, in Abraham Maslow's hierarchy of needs, as I mentioned in the hierarchy of needs, there is a pyramidal shape of Abraham Maslow's hierarchy of needs, starting with the basic needs, need related to the physical aspects. You can say that first order needs, these primary needs. After that, need of love and affect, need of identity and respect, need of safety and secure, especially need of identity and respect is most important need, the psychological need in these elderly people. That important, that respect we have to provide to the elderly people, so that they will be happy in the family, they will interact with the family members, they will emotionally attach with the family members. So there may be no chance of getting this type of mental health issues. Got it? And we have another few minutes time. Just I'll introduce the another area of counseling, that is counseling for children with behavioral issues. Counseling with children with the behavioral issues. That behavioral issues may be ADHD, that may be conduct disorders, that may be psychosocial disorders, that may be autism, that may be runaway behavior, and like aggressive type of behavior among the children. Nowadays, due to the change of lifestyles, children, especially the artists, even maybe small children or children of adolescent or pre-childhood stage, early childhood stage, later childhood stage, issues are more nowadays. For example, ADHD. What is ADHD? Attention deficiency hyperactive disorder. Attention deficiency hyperactive disorder means the children are not in a position to to pay their attention on a particular activity, which should be a meaningful activity. They pay attention on the phones. They may pay attention on their other meaningless activities, but they are supposed to pay an attention on a meaningful activity. If they are not in a position to pay attention, that means attention deficiency. Attention deficiency, no sitting tolerance. That it means hyperactivity, not sit at one place. So this is ADHD disorder, attention deficiency hyperactivity. So if you find this type of cases, so first of all, we have to check, we have to see the reasons. As I mentioned, for every issues they need to find out, we need to find out the reasons of this issue. They may be family environment, maybe the school environment, maybe the peer group, age environment, peer environment. These are all the various aspects we have to check. In some cases, the parents are not in a position to spend time, valuable time to the children. Yes, they'll give phone, for example, even some cases, even to feed the child also, to give proper, if he or she is not taking proper food, if he or she is not sit at one place to take food, what happens? The mother will give phone and he provide the food. What happens even from the very stage, like 6 months, 8 months, like more in these cases. Number one. Number two, maybe family issues like due to some conflict in the parents, things are not up to the mother. That is the reason of these issues. So we have to check the family environment. If the family environment is not proper, we have to provide the counseling to the parents first. Family counseling is needed. Parental counseling is needed. So ADHD, and again, other important one is autism case. Like ADHD, there are some symptoms of hyperactivity, not sit at one place, and impulsivity. These are the three important symptoms of ADHD. I repeat, attention deficiency, hyperactivity, then impulsivity. These are the three important symptoms of ADHD. Then second one is autism, autistic cases. These cases also increase nowadays. Autism. There are again symptoms of autism. One is speech delay, not sit at one place, delay response to the name call, then poor social interactions, poor eye contact, self-talk, self-love, self-cry, and self-solitary play, can say. These are all some symptoms of autism. Again, in this case also, we need to check family environment, how the school environment, how more are needed in the family environment. You have to provide the counseling to the parents, this parental counseling. Again, there is some reasons of that is prenatal, perinatal, and postnatal cases. This is also one of the important area we have to check while providing psychological counseling to these cases. Historical background also we have to check. School environment also. School environment means proper teaching methods are using in the schools. How supervisory persons like HMs and head of the institutions, whether they are supervising the proper way or not in the school or the institutions. Then the environment, the PH, and the teachers, how their relations with the children. What is the ratio of the parent teacher? Sorry, the teacher of teacher and student in the classroom, the crowded classroom. What is the strength of the particular class? How the infrastructure of the school? How the classroom environment? These are all various aspects we had to go through when we are giving counseling to the children of behavioral issues. Okay. Hello.
Sir.
Okay. Now already it's 1:30 now. Your class is at 1:30 and I'll conclude here. The rest of these topics we will discuss tomorrow at the same. Anything else?
Sir, are you planning to give some, notes kind of thing, PPT, because your depth of knowledge is so immense, we are really benefited. But if some reference could be given out, it will be, a record with us. Helpful at the time of exam. Kindly try, sir. Yes.
Yeah. Yes. Okay, I'll try to make it possible.
Sir.
If any reference books, I'll cite you. Okay.
Sir. Yes, sir.
Right. Yeah.
Thank you.
Thank you.
Thank you, sir.